Hello everybody, Suzanne with Donning Visions Hypnosis. We're going to talk about a subject that, well, may be a little uncomfortable, but certainly has a lot to do with reality. Have you found yourself disliking some of your patients? I know over the many years that I have worked in both mental health and in hypnotism and neurolinguistic programming that I have indeed had some clients and patients who I really did not like as people. It had more to do with the fact that they were not truthful, they played a lot of games, they lied, they were manipulative, and they didn't want to own up to it. These are not people that anyone can help. I don't care what your skill level is. These are people who do not want help in many cases. I can't say all because I did have some drug addict clients who would be in my face, and I was able to build a rapport by being equally in their face and just being very real and letting them know that under no circumstances were they going to be manipulating me. And I would just ask them, point blank, so your life is going so well? That's why you're sitting in my chair across from me right now? And then they have to admit, no, life is not going so well. And then I'd basically tell them, being the unlicensed person that I am, they had two choices. Either sit down and shut the hell up and do what I told them to do, or get the hell out of my office. More often than not, they'd sit there and they would do what they needed to do to actually try to get the help that they needed. I say try because when we try, we're not really doing our best work. We're putting in a bit of effort. And as I always tell my clients, the word try really doesn't exist in my practice. You either do it or you don't do it. It's as simple as that. It's a decision that needs to be made. So, yeah, there are times when we do find ourselves with people who we would rather not be sitting in front of us. And as we get more practice in screening clients, in my case, patients in your cases, we are much more able to discern who we want to have in our practice and who we do not. Of course, if you're working with an agency, you're going to be assigned different patients to work with. And if it's a real problem, hopefully you have a supervisor who will help you to move that patient to someone who may be better able to work with them because maybe their personality clicks better with that person. Because each of us do have our different personalities, and we're going to attract different people, and we're going to find different people easier and more difficult to deal with. That's just the nature of human interaction. So how do you discern if somebody is not really a good fit for you from the beginning? Well, you have to ask some questions. You have to ask them why they're there, like why they want the help. You have to ask them what they're willing to do to be able to make the transformation that they're asking you to help them do. You have to find out how invested they are in their own health care. You have to figure out if they fall within your scope of care. Now, for me, I deal a lot with emotional traumas, and that includes a lot of issues that have to do with other types of illnesses that traumas create, such as eating disorders, anorexia, bulimia in particular in my case, sex addiction, where there was no safe attachment between the client when he was an infant and the mother, either because she had drug addiction issues or majorly depressed, not really present for her baby during the infancy. And folks with anxiety, OCD, and depression. These clients come to me because they have usually tried to work with conventionally trained mental health professionals, and they haven't found any real relief in terms of feeling better. So what I do is I ask them these questions because I want to know how invested they are. I want to know if they're willing to do whatever it takes to heal. I want to know that they have the money to invest, even if it's a monthly payment plan for the programs that I provide, because I do not do one-on-ones. I do one-on-one sessions, but I don't do per session payments. They pay for a program based on the problems that they have to solve, which I found out through a detailed personal history, which allows me to understand the depth and breadth of the problems, and so I can create a treatment plan so I understand what needs to be done work-wise, and then I charge them accordingly based on the amount of work that it's going to take. So they're paying for a program to release their problems. They're not paying for sessions. Especially in the world of hypnotism, there's a lot of people who believe, oh, I'll just try it once and see how it works. Well, it doesn't work this way. If you had problems developing over a decade or more, it's not going to take one session to get rid of it if you have more complicated traumas that need to be released. That just isn't a realistic expectation. And so I don't sell one-session programs, except for people who want to stop smoking. But in that case, they have to have already gotten rid of their other emotional problems, or it's not going to take, in 99.99% of the cases from my 20 years plus experience doing smoking cessation. They have to really want to let it go. And it's not a matter of needing to, because they have some kind of heart problem or other physical illness going on. It's because they want to. Something that some people have a hard time discerning, especially if you have your spouse in your face telling you that you have to quit and you just want to shut them up. But it doesn't work that way, not as far as I'm concerned. Now, there are other people who say that they can help people stop smoking regardless of the problems involved. I have not found that to be true in my practice. Just saying. Our experiences are different. And I do actually have a very specialized training in smoking cessation that allows us to find out the cause. It allows us to find out the triggers and how to let go of the triggers and anesthetize them so they don't have withdrawals, et cetera, et cetera, et cetera. But for those who are not ready to let it go, they're not going to let it go. It's just the way it is. So I try not to hire them as clients because it just becomes a mess. So do yourself a favor and screen your potential patients. Make sure they're a good fit for what you do and how you want to work, and that they're invested both in terms of the emotional work that they're going to need to do to heal, as well as being willing to financially pay for it. Because I don't know anybody who does work that doesn't need to get paid for the work that they do. It just doesn't exist. Now, there are some people who believe that this should all be free. They're kind of crazy. And they most certainly are not the people that you want to be bringing on as your patients. You want people who respect the work that you do, who want to heal and are willing to pay for programs. And what I mean by programs is $5,000 and up for a program to help them. In my case, most of my clients can be turned around inside of 3 or 4 longer sessions. 2.5 to 3 hours is what I do based on my healing protocol, because I work in hypnotism and neurolinguistic programming, and it was the way I was trained to do it. And it works out really well because there's consistency of care. And they can just get in, out, and be done with it, which people who are professional people, they don't want to spend week after week after week going for client sessions. They don't want to be on medications that are going to dull their emotions or give them fuzzy thinking. They just want to be healed. So if you're interested in learning how to do this, integrating hypnotism and neurolinguistic programming into your practice, I do offer a 2-day VIP program. It's all done online, one-on-one. I only admit 1 trainee a week because I have 12 months mentorship attached to it, and I can only mentor so many people at a time. And you can find that information in the description below if you're interested in finding out more in terms of how to contact me. As always, I thank you for spending your time with me. Till next time. Bye-bye, all.